Struggling with mental health isn't something that you have to face alone. So here to get the conversation started is Serenity Mental Health Centers psychiatrist Dr. Jennifer French and patient Tara Hanna. Am I saying that right, or Hannah?
Tara Hanna.
Tara Hanna. Thank you so much for fixing that. I wanted to get that. So Dr. French, please tell us more about Serenity Mental Health Centers. Talk to us about it. I'm new to this.
So Serenity Mental Health Centers is a growing network of outpatient psychiatric practices that's committed to offering patients more than just the traditional route of medications for psychiatric issues.
I'm interested.
Yes, we offer various modalities of treatment, including transcranial magnetic stimulation, or TMS, to kind of help provide accessible and effective care for our patients. This is a non-invasive treatment that's used to treat depression, anxiety, OCD, PTSD. And when I say non-invasive, what that means is there's no surgery, there's no anesthesia, there's no sedation. So after a person receives TMS treatment, they're immediately able to return to their everyday lives.
No downtime.
No downtime at all. A patient will come and sit comfortably in a chair and have a helmet placed over their head. And this helmet delivers electromagnetic pulses. So when we're thinking about treating depression, I always like to come up with analogies because these concepts are kind of complicated.
Totally.
So I like to think of a depressed brain as a city at bedtime, a city at night. And certain neighborhoods within the city have no light. They're dark, they're dim, they're too quiet.
Got it.
Because there's a problem with the electrical grid in that part of the neighborhood. What TMS does is act like little super efficient engineers to go to that electrical grid and start sending sparks to the areas of the city that don't have power. So that we're able to get those neighborhoods back online, have light, and kind of come back to life.
Wow, that's so inspiring for someone who knows their dark parts. Like I can tell you right now, that's amazing. And does this work with other mental health treatments as well?
Absolutely. So it works in harmony alongside medications and psychotherapy.
You could do both.
Absolutely. So it does work as monotherapy, meaning it's completely effective to work by itself. And we've been using this for over 40 years. So certainly tried and true.
For sure.
But it complements medications and therapy by activating parts of the brain and optimizing parts of the brain that maybe medication can't reach.
Which is happening with me right now, and I'm having trouble even on medication. So this is something I'm interested in. Tar, can you share a little bit about your mental health journey? And first off, thank you for being here and being so honest. It's not easy, but we're breaking the stigma, and I'm happy about that. So talk to me.
Yeah, I'm happy to be here. So I've always struggled with my mental health from the time I was a kid and didn't really know how to express my emotions, let alone name them or deal with them. As a teenager, the only way I could deal with them was through self-harm.
Oh, wow.
As I got older, I continued to struggle. In my mid-20s, I lost some family members due to some fairly traumatic experiences, and I knew logically I needed help. But emotionally, I am a strong, independent woman.
I can do it.
I don't need anybody.
I'm fine.
I got this. And I wish that were true. I could do pretty much anything else. But I continued to struggle. Then cue to 5 years ago, we got to deal with the COVID-19 pandemic, which just exacerbated the issues that I was struggling with.
A lot of people felt that way,
Exactly. And while we were in self-quarantine, I didn't even leave my apartment to take the trash out for 3 weeks at a time. So things got really dark. The lights were out. And thankfully, I'd had some really close family members and friends who were dealing with their own struggles tell me about them seeking help through therapy and how that been so beneficial for them. Somebody actually referred me to their therapist, and that was the catalyst to get me to start seeking help. Now, as I had that first appointment scheduled, I'd had a pretty severe fight with somebody that I really respected, and that put me into a downward spiral to the point where I didn't think I could continue on with my life.
Oh, wow.
So thankfully, therapy got me to the point where I was able to move forward. I had some tools in my tool belt to cope, but I continued to deal with the depression and anxiety that kept me from living my life.
Absolutely. I know the feeling.
It's a big thing. And that brought me to Dr. French and Serenity Mental Health Centers, where Dr. French helped put a name to what I was dealing with and helped me find the right medication to start experiencing things again, to become functional and be able to work.
And be able to handle it. So let me ask you, how did TMS work for you?
Well, TMS got me to the point where, in addition to my therapy and the medication that we were on, I'm not dealing with depression anymore.
Oh, wow.
I'm not dealing with anxiety anymore.
Let me ask you, Dr. French, first of all, thank you for saying all that. Who is a candidate? Is anybody a candidate for TMS? Is it people like us who are really, really struggling?
Certainly. So candidates for TMS include anyone who feels like they're ready to take the next step in their mental health treatment. Perhaps these people felt like medications helped, but didn't quite get them fully to where they would like to be. Perhaps therapy has been helpful, but not as much as they would have liked. TMS is a really nice complement and can be very useful for treating these conditions. Also, if somebody is just curious about optimizing their mood, optimizing their brain, trying to have better energy, motivation, experience more pleasure and joy, these are all candidates for TMS.
Wow, so it's really about anybody that can do it.
Absolutely.
This is so wonderful. Thank you both for being here today. I'm just so honored because I'm really trying to normalize mental health struggles, and this has been so an honest and open conversation with results, which is really good to see. So thank you for being here today. So learn more or to book an appointment at Serenity Mental Health Centers, I want you to call 303-857-5646. Take a screenshot of that so you can share with someone if you want. You can also find them online at serenitymentalhealthcenters.com/Colorado-psychiatry-clinics. They sponsor today's segment.